It's okay. It worked that way last time.
Go ahead.
Hello. Good afternoon. My name is Dr. Nilda Lopez. I am your host. This is Tea Time with Quest Care.
I'm excited already.
She's too excited today, okay?
Yes.
My name is Dr. Nilda Lopez. I'm your host. I'm a family medicine doctor at the Quest Care Medical Clinic in Capel. I also specialize in geriatric medicine. Today, my host is the beautiful Dr. Jyoti Bharti.
So sweet. Thank you,
She also practices here with me at the Quest Care Medical Clinic in Capel. And she basically is amazing. She's a family practitioner. She also specializes in geriatric medicine. Briefly, Dr. Bharti is a board-certified family medicine physician. She received her bachelor's degree from the University of California. She further completed her medical degree at the American University of Antigua College of Medicine. She did her residency in family medicine at the St. Elizabeth Medical Center. Dr. Bharti takes care of a wide array of patients, basically from newborn infants to geriatric patients. She's amazing. We all love her. She does great work, and it's good to have her here today. We've been having discussions over the past few weeks on the same sort of similar topic. I do want to mention, so thank you everyone for joining us today. If you do log in, we want you to type in your name so that we do know that you are here. At the end of our talk, we will have a raffle and a prize for you. So type your name, say hi. If you have any comments or questions, type it. That way I can see it and I'll read it out and we'll answer any questions that you have. You want to engage the audience. If you like everything we do today, I urge you to please share our video and like it as well and comment on it, okay? Also, one more thing that's important. I want you to know that remember all the information that we are sharing here today is not any personal advice specific to anyone. The information you get here today is for your information and entertainment purposes only. Okay? And so our topic today is effects of depression in patients during the COVID pandemic. So COVID has taken a significant impact in our community. It's affected a lot of people, and depression is huge, and that's why for the past few weeks we've sort of been, addressing that topic and trying to, bring to attention like the seriousness of it, and for patients to recognize it. I mean, I know we are specialists in geriatrics, but we still treat a wide array of patients. And so today we will delve more into depression as far as it affects the entire patient population. I do, see patients that have depression all the time. I can tell you a quick story of, one of my cousins that really suffers from depression a lot, and it truly affects her. It's hard to be functional, to wake up and go take care of her children and do anything, like to be a good mom, and depression is real.
It is.
Absolutely. It doesn't matter how good of a person you are, it can still affect you.
Absolutely.
And it's okay. And so, just having all those contact points of seeing people that I know that have been affected with it, I'm always very aware.
Absolutely.
And pay attention.
Aware of it.
Try to guard it. And so what would you say, let's refresh people on what depression is, and we can go into more things about it in a minute.
So thank you again for having me here. Hello to everybody, and thank you for joining on Tea Time with Quest Care. Taking 2 seconds to say how wonderful Dr. Lopez looks today. I love the pink
You love it. You
look gorgeous. I love the earrings. Your dangles are.
This is African. I got these in Ghana last year.
Fabulous on you.
Yeah.
So I wanted to bring that out and say how gorgeous you look today.
Thank you.
We're continuing our talks about depression. We talked about in the previous ones depression, anxiety. We spoke about geriatric depression a little bit in the past, and it's a very vast subject. I cannot cover everything, and both of us try very hard to give you little tidbits, but it's a vast subject. Today we are specifically focusing on pandemic. So a little bit about depression. Depression is that state of emotional and psychological issue which makes you ineffective in being functional in your daily life, unable to do your activities of daily living or independent activities of daily living. Depression, anxiety, making you feel sad, making you feel fatigued, making you feel tired, unable to concentrate, unable to focus, finish your job tasks, finish your house chores, be able to be, like she mentioned, be a good parent, be unable to be a good employee. When depression becomes so bad clinically and you're unable to function function in your daily life, we wanted to bring that into attention today. With the COVID-19 pandemic, what we've been saying, both of us, we've been saying that depression and anxiety is on the rise. It's actually not only amplified for the patients who are suffering from this, but we are seeing more and more that patients, my regular patients, patients who do not have history of depression or anxiety are now at the verge of becoming sick with mental health disorders during this pandemic, and that's what I've been seeing. Why? COVID-19 pandemic is causing significant stress and psychological distress.
It's changed people's entire lives.
It's a stressful situation.
And no one saw it coming, right?
Absolutely.
No
we were
one
not prepared.
No.
We never thought we'd be
in
this
December
pandemic.
2019,
Yes.
at the end of it, you sit down, you write, 2020 is going to be good. You write,
You're making
what's
plans.
good. Yeah.
Travel
2020,
plans.
these are going to be
Birthday
what I'm
party
going to
plans.
do, right? Everybody starts the year brand new, right?
Yeah.
You write out everything you're going to get done. And then February
Hits February
and
and
everything changes. But that's okay, right? Because it's okay when things happen. You try to figure it out. You prepare yourself. Maybe you may have lost your job, which could have caused you to become depressed. A lot of things have happened.
Yeah.
With this whole, it's affected the economy, right?
Absolutely.
So a lot of people are suffering with it. But you have to look at the bright side of it.
And I have some tidbits for you guys, what we can do to help you with that, and I'll mention that before we end the session.
And one thing, I want to, hello Miss Taylor for joining us, thank you. I see Lamonte, thank you for joining us.
Hi.
Anybody that joins us, please
say hi.
Yeah, say hi, put your name so we can know that you are here. This is Tea Time with Quest Care. My name is Dr. Nilda Lopez, and my host is Dr. Jyoti Bharti, and we are talking about COVID-19 and the effects of depression, in patients. And so we can move on.
So we'll continue by one big thing I'm seeing that why is depression and anxiety so much in COVID pandemic? Well, the very first important thing, I'm afraid of getting COVID.
Yes, everybody's afraid.
And I'm
every
afraid.
day.
Think about general population. General population at the moment is scared of getting the disease, getting the virus. Let alone that stress, you're worried about your loved ones catching it.
Yes.
And that is a significant
And taking
stress
it home from
anybody.
work.
Taking it
every
home
day.
from work, for me at least, taking it home from work. I know patients who come and tell me, if I go to the grocery shopping, do you think I'll get COVID?
Yeah.
That's stress. And that's what this pandemic effect has come along, and we've been seeing it so much. Patients are stressed not only from this widespread state of catching it, but their loved one catching it.
Yeah.
One thing that I saw that in geriatric patients quite a bit, and it is sad, is grief, losing the loved one in this pandemic.
Oh my goodness.
And
yes.
that grief itself is a major risk factor for depression in geriatrics. So that's one thing I did wanted to bring upon that. The one thing she mentioned, besides me getting a disease, my loved one getting a disease, losing a loved one, is the unemployment, job security.
A lot of people have lost their jobs.
Housing.
A lot of people have been furloughed.
The furlough itself, that stress of how am I going to provide for me and the family is causing some major depression and
I think we need to speak up some more.
Absolutely.
We need to speak up more.
Yeah, I see. That's a geriatrician. She always beats you. Yeah, we'll try to work on that. So the effect of financial insecurity that health pandemic has brought upon patients is actually adding more to their depression and anxiety. And then reduced access to caregivers,
Yes.
unable to have caregiver, unable to provide even as a caregiver. That access is reduced further, causing more stress and anxiety in your life.
Yeah.
And then one thing I came across, and I made a TikTok video about it too. What I'm seeing is worsening and increased use of substance abuse, alcohol,
Yes.
tobacco, and other substances,
Yes.
which we have been seeing quite a rise during this pandemic.
Because you have more time in your hands, and it's
Yeah.
just a lot. It's just like we talked about last time, the infomania and just the overwhelm of information, and everywhere you turn, everywhere you go, people just giving you, some people even saying, oh, wearing masking is bad for you, this and that, right?
Misinformation.
Right, misinformation. And they try to give data to support the misinformation, right? But the only reason we know it's wrong because we're scientists, and so we can look and try to verify, know that it's not right. And so it's just hard, it's difficult, and we completely understand. But we are with you. We're here with you. And that's one thing that
I'll be posting some TikTok videos that will tell you that we are with you guys during this pandemic effect, during this stressful situation. Quest Care Kopal is doing whatever we can to not only help patients medically but even emotionally to distress you. I release these TikTok videos every Thursday.
And all of Quest Care, really, all the Quest Care clinics,
and all the Quest Care,
amazing doctors, and all of the Quest Care clinics, and we all work together, and that's what I love. That's what I love about this company is how well we all work together.
We take care of geriatrics. She said we take care of a wide array of patients. So one thing I want to mention, one very important thing that I saw, Dr. Lopez, why patients are becoming so depressed and anxious and stressed, because their chronic health
they're
problems,
not taking care of that.
Is actually worsening. Why? Because they are scared to go to the doctor's
Yes.
office because they might catch the virus. And it's a legit scare, I understand that. But in the midst of this, patients' actual general health is becoming worse. My husband is a hospitalist, and every day I ask him, so more COVID patients you saw? And he said, no, I saw more heart attacks and more strokes. And the reason why, because our chronic health, chronic problems, chronic comorbidities are getting worsened and worsened, which is adding further to your depression and anxiety, which is further worsening your mental health. So I highly recommend, guys, that please take care of your health in terms of your chronic diseases. Obviously, reach out for mental health. We are here for that as well, but do not neglect the chronic health that you, or your, when I say chronic health, I mean to talk about your hypertension, your diabetes, your cholesterol issues, thyroid
even
issues.
the well child checks, like taking your kids to get the vaccines so they don't get behind, because that's the major thing. People are not taking their kids, and so then okay, well, are the kids, if they're missing all their shots, are they going to get measles later and show up in the clinic with measles, or are they going to show up with Haemophilus influenza, something, just making sure that they're still keeping up with all their vaccines.
Keep up with your health, keep
everything,
up with your loved
children
ones' health.
and everybody.
Very important.
Hello, Ms. Dina. I want to say hello, Miss Amber. Let me see who else is on here. Hello, Marlene. Thank you everyone for joining us. If you have any questions while we're talking, please put it on there so Dr. Bharti and myself can answer it. We are talking about the effects of depression in patients during the COVID pandemic. Okay, and I know last time we were talking about medications that we use to treat depression in patients and the different classes of drugs that are available on the market. We can talk a little bit about the medicines, and also later on we can sort of dive into what kinds of side effects and what kinds of things can too much medicine cause to a patient. So what are the kinds of medicines? Let's just start with that.
So few medications we mentioned previously in our previous Facebook Lives. We talked about very famous SSRIs. We mentioned about non-SSRIs. We mentioned about monoamine oxidase inhibitors. All my doctor friends would know that. Or tricyclic antidepressants.
You talk a little bit louder, Dr. Bharti.
So these medications...
I feel like we need a microphone.
I know, right now I need a microphone. So there are a lot of a lot of medications out there, and the medications do come with side effects. For geriatric patients especially, we keep side effects into mind and we try to only prescribe that will not interact with their other medications. For youngsters, I have a certain medications I like to use to make sure that they don't have a very common side effect is increase in weight and then sexual dysfunctions. And so we try to choose medications and help you to combat this disease.
Sexual dysfunction is huge,
medication.
not just in younger people, even older people.
Yeah.
Sex is important, right? It's a part of life. And so if you have to be on a medicine that makes you impotent or, you know,
decrease libido.
right, all
Yeah.
of that. It's a huge, or having like ejaculatory problems, right? Antidepressants can do that. And you know, we try to use, if the medicine's having side effects, then we try to switch it, which we do a lot.
We try to use a max dose. If that works, great. But if that doesn't work, we either change it. Sometimes we augment your therapy. We add something else to your therapy to further give you a boosted effect.
Yes. Or we switch up the medicines.
Yes.
So there are, I want to mention, like in treatments of depression, there are different phases, right? There are 3 phases of depression. There's something called an acute treatment phase. And the acute treatment phase is like when we initially start you with medication. Acute treatment phase can be from like 6 weeks to 12 weeks. It's just until the person gets out of the depression.
Yeah.
Sometimes the acute phase can last up to 2 years. You're treating the person with medicine, they're not getting better. They're still like feeling depressed. So we're changing medicines. We're doing everything Dr. Bharti mentioned, like augmenting the therapy, doing all of that. And all of that is in the acute phase. And after that, then we go into what we call the maintenance phase. That lasts about like 6 to 12 months, where we continue the same treatment, the medicine that worked. And the reason for that, for about 6 to 12 months, the reason for doing that is because with depression, we have to give the brain time to heal, right? And so it's sort of, you want the brain to go back to its non-depressed state.
Yeah.
And so we continue the medicine for that period of time. And after that, there's that, you know, there's the next phase. There's there's the acute phase, the continuation and the
maintenance.
acute maintenance and continuation. Okay, yeah, continuation is the last one, and we just continue the medicine for 6 to 12 months, or however long the person needs it. Some people get completely better, they can get off the medicine. Other people don't.
And I do want to mention that I don't want people to think if I mention depression, she's going to give me a medication, I'll be on it lifelong.
Right.
And guys, one thing I want to say, depression is a mental health condition. It is a disease. So yes, sometimes I will have to use a medication for you for more than 6 months, more than a year, even lifelong. I'll say that.
Exactly.
But trust me, I and Dr. Lopez work very hard to give you a drug holiday, to work towards you that, hey, your symptoms are better. Maybe now we can de-escalate on the therapy a little bit. Now let's cut down the medication and see how you do. Let's do drug holidays today, and let's see if you do. Multiple times we've done that because we have been able to. I'm not going to say that we cured and that's why the patient is now off the medication. The patient, we try to work with patient together. You have to realize depression is not just all medication.
It's not all
there
just
is
medication.
Cognitive behavioral therapy. So
vitamin CBT.
Vitamin CBT. There you go. So using those two
Our
techniques.
favorite vitamin.
Yeah, and why she talks about vitamin CBT, because CBT helps you learn the negative thoughts, the negative things that are not helping you to function in your daily life, not helping you to be effective. They help you work on that. They help you learn those thoughts, those symptoms, and then how to work with it is what CBT does. And once you have that mastered, I feel safe and the patient feels safe that, okay, I know if I get that symptom,
the things you need to do,
what to do, how to
it.
cope with it. So then maybe I can be off of the medication and see and use those techniques, and then maybe I won't need the medication. And again, we work with our patients together on this, recognizing it, working towards it. And it's okay if the symptoms come back, because I can then slowly restart the medication and get you feeling somewhat functional and better. And we get you to your maintenance and the continuation part.
Quick thing,
Yeah.
Dr. Bharti. If you're just now joining us, this is Tea Time with Quest Care. I'm your host, Dr. Nilda Lopez, and my guest speaker today, It's Dr. Jyoti Bharti, and we're talking about the COVID pandemic and effects of depression in patients. I did have someone comment here. Lamonte said that he has family that's dealing with this issue right now.
Absolutely. Yes,
so, this is truly affecting people.
And as I mentioned, guys, people who are suffering from depression, anxiety, those symptoms are getting worse. But people who don't have the mental health condition are now actually getting diagnosed with it because, again, we are in a very stressful situation with this pandemic. So I know that you are going to be having symptoms of anxiety, having symptoms of panic attacks, are going to have symptoms of depression. And I want this message across that we are with you guys on this. If you get anything from this message from the live video today, just know that any QuestCare Copal is where I and Dr. Lopez are, but any QuestCare, seek help. Talk to your primary care about your symptoms, and I'm sure they will be able to come up with a plan and try to help you. And I also want to tell patients that depression, anxiety, these will take some time to get fixed. I wish there was a medication that I can give you and give you
easy fix. There's no easy fix.
There is no easy fix.
And televisits even, right?
And I was just about to talk to you guys about that. Yeah. That I came across this Mass General psychiatrist who mentioned that they are doing 97% of televisits, performing telepsychiatry for their patients, and he mentions that they are just as effective as in-office visits.
Yes.
So guys, do not shy off from contacting the primary care's office and making a televisit appointment. Get diagnosed and get help. Televisit, telemedicine, thanks to technology, we are now able to reach to you while you're in your home. A lot of patients do get feared. They get panic attacks. If I go out, what happens?
Yeah.
And I understand that phobia. Well, telemedicine will at least help you cope that and combat that.
We have a question that's been asked here, Dr. Bharti. Lamonte asked, how do you deal with a family member that's dealing with depression?
Very good question. Very,
how do you
good
deal
question.
with that?
Very first thing I'll say, definitely reach out to the family member, connect with them, have them see their primary care, first and foremost. Whether you do it via televisit, whether you do that in office, whatever patient is comfortable, definitely talk to your primary care.
Yes.
Now, some non-medical side of that is, we talked about some medication. So if the primary care deems that, okay, this is a condition of depression and anxiety, they will promote with medications and help you with that. Obviously, they're going to talk to you about reaching out for therapy sessions, cognitive behavioral therapy, and they'll refer you to some psychotherapists who can help you together with your medications combat these symptoms.
We have one more question that we can address before we end here. Yeah. So Taylor asked, is medication always the answer for anxiety? Dr. Bharti, what would you say?
There's a yes and a no answer to that.
Okay.
So anxiety comes in the format of panic attacks. Anxiety comes in the format of phobias. Anxiety just comes about generalized anxiety.
Yes.
So for those things, sometimes, yes, you need medications. And that's probably the only thing that will calm your symptoms.
Yes.
But you have to also look into vitamin CBT.
Cognitive behavioral therapy.
With medication together will give you the bestest results in taking care of your anxiety. At least I would say that. I would not just say only medication, because multiple studies show medication with CBT shows the best effects in anxiety and depression results.
And when Dr. Bharti says CBT, she means cognitive behavioral therapy. So you seeing like a psychologist or a counselor, therapist talking through this stuff, and other forms of therapy like aromatherapy, exercise therapy, other different therapies that they do, right, to help to combat anxiety. All those forms are effective, okay?
I'll mention just two things today. I know in this pandemic, everybody's distressed. Everybody's super anxious and now are having symptoms of depression. First thing, talk to your primary care. Second thing, take care of your body.
Yes.
Third thing,
exercise. Yes.
Connect with your family, connect with your neighbors, connect with your community, offer help. You don't. I know with the social distancing, we are unable to go meet door to door, but that's okay. We are in this beautiful technological world. Video calls, Zoom chats, text messages. Just say, hey, are you okay? Just saying a quick hi, I was thinking of you. definitely use that avenue for your friends and families, especially for your elderly family. And
Yeah.
then I came across these apps that I thought I'd share with you guys today. This app called Headspace.
Okay.
It's a beautiful app that will help you in stressful situations, in your stressful thoughts. It has beautiful calming music that you can hear too.
Oh, I like that. What is it called again? Can you mention that?
Headspace. It's
Head
called
space, like
Headspace
head
One.
and then space?
Yes.
Okay, as
Right.
one word?
One word.
Okay.
Download that app. I think it is free.
Okay.
Something to kind of help you manage your stress and anxiety in your daily life. Another one I came across, I think it was called Evermind Health app.
Okay.
Look into those apps. These are some small avenues that you can use for yourself to not feel stressed, help you calm down, help you take care of your daily life, help you take care of your job and your family.
I know we're out of time.
Sorry, I like to talk.
Yeah, we're out of time, but
this is so much to talk about. So much to tell you guys.
It is a lot.
Yes.
It's a lot to talk
Yeah.
about, but we're always here. I feel like I'm gonna knock
Yes.
our thing over. And so, I'm so happy for you guys joining us today. And if anything that Dr. Bharti and I discussed today, if you learned anything, you want to continue the conversation, you want to learn more, we are at Quest Care Medical Clinic. So you can go to www.questcaremedicalclinic.com. You can also call the general Quest Care number, which is 214-712-2054. Again, the number is 214-712-2054. There are 11 Quest Care locations in the DFW Metroplex. There are amazing doctors at each of the locations. They will be happy to take care of you. If you live in the DFW Metroplex, I recommend you to please go to any of these avenues and get these issues addressed. So think about if 3 to 6 months from now you felt completely better, you were no longer depressed, your mood was better, you were able to just enjoy this phase of your life, moving on to the new phase, and we can help you to achieve that. And so I want you to take action and act on everything that we've told you today. I would want you to like our video, to share our video within, with all your friends, your community, to comment and write great things about it. If you learned anything, if you have any further questions, post it. We'll talk about it at our next session next week, Thursday. I know it's 12:30, so we have to go, but
Sorry, we'll be back again.
yeah, so every Thursday we are here. Every Thursday at noon, join us. We'll be happy to talk to you. We're gonna quickly do our raffle before we leave, and also remember our tele-visits. We do tele-visits, and so if you want to just see us from the comfort of your own home, we will be happy to see you and address all your issues.
And both of us are at Quest Care Capel if you want to see us.
Yes. And okay, take that, and then I'll let you pick it today, Dr.
But
Bharti.
you look so gorgeous, you pick it.
Okay. Well, let me close my eyes. I was gonna pick the pink one because I'm wearing pink, but I don't want to be.
All right.
Let's see. LP
again.
LP won.
LP won the raffle for
Yes,
today, guys.
LP. Your gift is right here. Dr. Bharti has it. So our team will be contacting you. I thank you guys, everyone, for joining us today. We enjoyed it. And so thank you. See you next week, Thursday. God bless you. Bye. Thank you. Thank you, Dr. Bharti.
Thank you.